So chatting a bit on medication and what that looks like for families. So as a pediatric occupational therapist, I've worked with a lot of families who have children who are either on medication or off medication for specific diagnoses, including ADHD and anxiety. And what I found is that what the medications do, their job is really to mask or alleviate the symptoms that are associated with the diagnoses that create an experience that is like a struggle or is dysfunctional per se. Now, that being said, when it masks those behaviors or symptoms, when a child then comes to me as an occupational therapist, and even as a parent, it becomes really difficult to understand what's going on with their processing because the behaviors that they would naturally do or the symptoms that they would naturally do, the way they naturally act is masked, it's shut down by this medication. And so it becomes very difficult to know, well, how can I support my child's processing in this specific way? What activities can I do to release these certain neurochemicals in the brain to rewire the pathways or strengthen these certain pathways so that my child is better able to independently and consistently regulate, because that's what a lot of the medication does. It helps with regulation. Those are a lot of the symptoms that you see, like the struggle with attention, the hyperactivity, the anxiety, can be related to regulation, which is a function of what the brainstem does. And if you're unable to process well at the level of the brainstem, then you become dysregulated, for example. So that's what a lot of these medications do. So when a parent comes to me for like a pediatric occupational therapy assessment, then I will suggest that if possible, they can spend time going off the medication, because when they go off the medication, then you'll be able to see exactly what the behaviors or the symptoms or the outcomes are, which are a direct reflection of what's going on with the processing. And then you can determine, okay, is the brainstem overwhelmed or underwhelmed? And then, like, what is the regulation pattern? What is the dysregulation pattern from that? And it can just be really hard to tell with medication because the medication masks that. It helps with that. So that's what I recommend to parents. Now, of course, that's not always possible. And in a real world situation, that's oftentimes not possible. So then having parents think about, okay, before my child went on medication, what are the patterns of behavior that I saw? What were the patterns of dysregulation? Did they tend to have an overwhelmed brainstem or an underwhelmed brainstem? Meaning, were they more hyperactive or were they more like anxious and aggressive? And so there are these two categories that are very overgeneralized, but that's essentially what the dysregulation patterns fall into. And so thinking about that thinking of their child before they went on medication, and what does that look like? So that's what you can do to start looking at that pattern. And when I'm thinking of overwhelmed brainstem and underwhelmed brainstem, I go more into this in some of the programs that I'm offering, because that's the basics for regulation, and really understanding as a parent what goes on with the processing can really, really help you with your child and understanding your child, and then coming up with these activities that really specifically release neurochemicals that are made to rewire the pathways based on what your child is experiencing in terms of regulation and dysregulation. So it is really, really cool. Medication does mask that. That's the point. So if you can go off medication during an assessment, that can be helpful. If you can't, then think about what your child was like overall and what the patterns were of behavior before they went on medication. So medication can, of course, be helpful. And it could be helpful in a temporary situation if you need your child to regulate. In school, whatever, it can be very helpful. There are some side effects that you should always know about and talk extensively with your pediatrician about. But if you're in a process of approaching sensory processing and want to rewire the brain through a more intensive program that is consistent and frequent and can really make a difference, then having the medication there can be more of a hindrance to that. So I'm not saying don't go off medication, and I'm not saying necessarily go on medication. It has to work for the family and what you're dealing with. And the other thing that I would say, if you have a child who has ADHD specifically, a lot of times there's anxiety associated with ADHD. And so if a child goes on, and I've seen this, goes on like a Ritalin or a stimulant, when they have ADHD and they also have anxiety, that can increase their anxiety. So that is one thing to look at and make sure that you talk about, like, what are the different kinds of medications available and make sure that you don't fall into this box of, okay, well, my child has ADHD or my child has a specific diagnosis, and you avoid or you don't take into consideration the other like behaviors or outcomes that you're seeing, like anxiety, because if you go on a stimulant and you're already anxious, that can increase anxiety, and I have seen that in kids. So that's just another thing to keep in mind if you're considering or going to talk about medication. So that is my take on medication. If you want to know more about kind of what I do in terms of supporting sensory processing and the program that I do that can be done at home with a parent that is based on connection and doing certain movements that release specific neurochemicals in a specific order that over time, like 3 weeks to months, really rewires the brain so that the child can independently and consistently regulate by themselves, then certainly message me, because I have programs that go into this in more detail. But if you are in the process of considering medication, make sure you take into consideration all of those factors, knowing that it masks the behaviors and the symptoms. It does help, especially in like emergency situations, or if your child needs to be in school for a certain amount of time and they need to focus, that can be certainly helpful. But if you think of long term, what do you want to do for your child? And I think that's where sometimes we kind of get lost in the medication world. And we don't consider maybe the full child and everything that we see. So that is my take on medication, and I hope that is helpful.